So my name is Joerg Luedemann. I'm from Falkensee, and Falkensee is a suburb of Berlin, so I had a long travel with the S-Bahn to here. And so I was involved in the DEPICT 1 and the DEPICT 2 trial, not as a coordinating investigator for Germany as well, but as a treating physician. So I had a lot of experience with treating type 1 diabetics with the SGLT2. So I don't want to repeat the design of the study, so you heard that before. So we put then a post hoc analysis of the different diabetes duration, seeing are there any different effects in patients with long or with short diabetes duration. It's worth to mention that the people were included in the study with a C-peptide at baseline below 0.7, so we're an insulin deficient patient only and clear type 1 diabetics. So there was a post hoc analyzer, full analysis set, and so with all the statistical limitations of post hoc analysis, and so we don't have any clear p-values in the analyzer, but there are some interesting things to see here. So first of all, the baseline results, we see there are a lot of groups with a diabetes duration below 12.9 years and between 12.9 and 23.5, and patients with a diabetes duration over 23.5. And the groups are well balanced, roughly 180 patients in each group and each dosage, and we don't see any great differences in the percentage of women or men, but there is some slight increases I want to mention for the one who were not able to read it due to the distance. With the diabetes duration, the body weight is slightly increasing from 77 to 85, and the BMI is following that. So the A1C itself is balanced in the groups, but with the patients with a shorter duration, there are less patients in good control, and if the patients in a longer duration, there are more patients with good control, rising from 70 to 80%. So there are a lot of patients in good control with a longer diabetes duration, regardless they are older and they have less C-peptide. So it makes no difference if the C-peptide is responsible for that. So seeing the total the change in total insulin dose, so we had roughly 58 units at baseline, and in the end there is a decrease in the treatment groups by up to 53% without any clear difference in the diabetes duration groups. So we see that there are roughly 20% insulin reduction, as was distributed with the bolus and the basal by the decision of the treating physicians as well. There are no recommendations or protocol how to adjust your insulin as well. So here you can see the A1C data, and again, despite all the limitations of a post hoc analysis, we see a trend that the A1C reduction might be better in the treatment in duration group below 12.9%, but remember there are more patients in good control with longer diabetes duration in comparison to the shorter diabetes duration. So it is not adjusted to the groups below and over 9.0%. So the next we can see the weight difference in the different groups. So when we have a slight increase in the weight reduction with the diabetes duration, but again at the baseline we saw the older patient had a little bit higher weight at baseline, so it might be balanced in the end. So, but it is important to know that the diabetes duration had not a clear reducing, so the A1C reduction is not compromised by the diabetes duration as well, and the weight reduction as well. So we have no clear difference between the groups. So the conclusion is that it works in patient with low and patient with high diabetes duration rates. So next, the variability. So we talked about in the last poster, so we're over the MAGE. And there are some reductions in variability shown by the MAGE and presented time and range. And it seemed there is a better reduction in the patient with a longer diabetes duration in comparison to the shorter diabetes duration, but without any significant differences. So the conclusion might be that is the SGLT2 inhibitor in type 1 diabetes is safe and effective, and regardless from the diabetes duration, despite any trends, but the trends may come from the differences in baseline characteristics. Thank you.